Hey guys, Dr. Rodney here with A Place to Grow Chiropractic. I want to talk about the number one statement I tend to get when I'm outside the office. And it's usually the statement I get when I say, hey, yeah, I'm a chiropractor. That statement is, oh, I tried it, it didn't work for me. And usually after investigation, I tend to figure out why it didn't work for them. When patients or people tell me chiropractic didn't work, I always have to come back and say, oh, well, what was your experience like? Just like anything else, if you go into a doctor's office or a dentist office, there are really good ones and not so good ones. And then there's some that fly right under the radar as not good or bad, but we go to them anyways. A lot of the individuals that I speak with that say it didn't work for me, it was a result of failure of that doctor to educate, false expectations, and the inability to show progress. In our clinic, we use a lot of testing, usually orthopedic and neurologic testing. And don't worry, there's no pokes, prods, or pins or needles. It's truly off of function on how your body moves. We use functional analysis, specific body movements to see if you're able to perform them and how you're moving there. And through doing that, we establish a baseline. Now, when we take that baseline, we then look at age, body type, health objectives, and talk about a realistic goal setting for that. We talk about a timeline. We talk about how you're going to be able to do that. And we talk about responsibilities. I absolutely love caring for patients, caring for people. But what drives me nuts is when someone says, all right, doc, it didn't work. And if there's a two-prong approach to the work that I have to do and the work that we discussed that you need to do, and only one person's doing their work, and that's you showing up to the appointment, we've gotten halfway. So we may not get there as fast as we want, but we can make progression or strides forward. Now, the other part that people say it didn't work for me is sometimes a condition that enters into the clinic, we may not be the right place right then and there. It's the truth. So what do? We refer you out. We get you into the hands of the people that you need to be with, whether it's physical therapy, back with a primary, out to an ortho. We don't have the objective of pride in our way. We have your health as our objective. So if you need to be referred out, that's where it is. We get to run these ads and we get to do these items because our primary objective is helping have a healthier community. It doesn't necessarily mean that every person right now in the community needs to be seeing us. And some people want to see us, and we're just not the right place. So the question is that drives me nuts, as I stated earlier, is, oh, I did chiropractic once, and it didn't work. It's not necessarily that chiropractic didn't work. It's that maybe that doctor didn't work for you. So I welcome you. Take an opportunity. Come visit us at A Place to Grow Chiropractic, where you get two minds for one, and more importantly, you get a practice that's patient-focused and centered instead of pocketbook centered. Thanks.